Welcome everybody. Whilst people are joining, we'll just do a little bit of housekeeping. Welcome to today's My Whole Self webinar. It is going to be recorded, and the recording will be made available afterwards. The camera and microphone, your camera and microphones will be automatically switched off. We have had over 2,000 people sign up, so there's unfortunately we can't have a cozy conversation, but please do chat with other people in the chat function. Tell us who you are, where you're from, anything that you'd like to tell us about yourselves, but please, if you do have questions, can I ask you to use the Q&A function so that we can then come back to those questions towards the end. And there's also got some colleagues who are going to answer any questions that may be other questions as we go through. And the presentation will be available. So we'll just wait another second or two until people coming, so I can still see the numbers are going up, but I can also see that you're from Devon, Cornwall, Essex, Wetherby, Scotland, Australia, Shanghai, Hackney. So we've got Isle of Wight, Salisbury, Sandwich in Kent. Brilliant. So we've certainly got a great spread of people from all sorts of places. So delighted to welcome you. My name's Simon Blake, and I'm the Chief Executive here at Mental Health First Aid England. Today is My Whole Self Day, and that was first launched 4 years ago. The idea initially was that there'd be lots of events which are happening all across offices and workplaces, and then we got locked down. So it very quickly changed, but this is the 4th year, and this year the focus is on empowering managers to manage well. I'm just going to tell you a slightly funny story before we kick off. The second meeting, second webinar, which we had, could everybody's microphones be put on mute, please? Just a bit of background. The second webinar that we had, my partner was wearing the same shirt as me. They walked into the kitchen. We were working from home, and so I said, in the spirit of my whole self, I'm just going to share, my husband just walked into the kitchen wearing exactly the same outfit as me. They then, being a dentist, not knowing about webinars and running webinars in that sort of way, just stepped on, saw somebody who they happened to know who was on the panel, started having a conversation with Sheldon, at which point I then said there are another 900 or so people on the call. So unfortunately my husband won't be making an appearance today, but it does always make me smile to remember that moment of acute embarrassment which we had. So as I said, today's focus is around managers. My Whole Self campaign as a piece is around workplace culture change. It's about trying to create organizations where employees are able to bring their whole selves to work. And by bringing our whole selves to work, it's really about being able to express ourselves, being able to feel seen, heard, valued, to feel psychologically safe, and to have organizations where the culture is one that believes that well-being and productivity fuel one another. That work done well is good for us. Work designed well can be good for us, and that we can create workplaces where teams feel safe, where they feel connected, and that we can, I guess, operate at the edge of our brilliance because we are trusting and confident that we're valued in that workplace. And of course, managers play an absolutely critical role in making that happen. As I said, I'm Simon Blake, and I'm just going to ask Jemima and Bethany to introduce themselves and tell us a bit about their whole selves. So Jemima.
Thanks, Simon. Typical not putting my mic on. But yeah, so I'm Jemima Nkrumah, pronouns are she, her, and I am sunshine yellow every day. So if you were wondering, this is me. I'm a happy-go-lucky practicing Christian who's dedicated to my family and driven by my desire to help others and care and support others as well. I am absolutely head over heels when it comes to food. Anything that has food involved, whether it's cooking or eating, I am definitely in and all in for that matter. I'm currently working with Grant Thornton as the Inclusion and Diversity Executive within the firm. I've been with the firm for 5 years, but in this role, I've been in this role for a year. Absolutely love my role, and I have a fantastic team that I work with. We're involved in all of the discussions regarding inclusion, diversity, health and well-being. So working with our inclusion allies and mental health first aiders and several stakeholders. And I absolutely enjoy what I do. I have a health degree. So I did start my career off in the health industry within the NHS, but I quickly realised that that wasn't where I needed to be, because a lot of the things that were going on weren't things that kind of conformed to who I was as a person. I wasn't being true to my true self. So I moved on into the industry, interesting industry of professional services, and that's where I've been for the past 5 years and enjoying it. Well, thank you.
Thank you, Jemima, and thanks very much. And then to Bethany, our other panelist today.
Thanks, Simon. Morning, everyone. My name is Bethany Carter. As you can see, I love live music. I have 2 kids and they have multiple clubs, so I taxi them everywhere and anywhere they want to go. I'm a loyal friend. Many of those friends I met through my military career. So I am a military veteran. I served for 17 years, both in the Navy and the Army. And so I've got 2 props, actually. I lied earlier. So these are my military medals, which I'm very proud of. They are a huge part of who I am and who I've become today. But I also absolutely love glamping, either with my kids or on my own to escape. And I have that little mock glamping set up here in the background. I am the lead Freedom to Speak Up Guardian at Solent NHS Trust. So when I retired from being a nurse in the military in 2016, I joined the NHS originally as a specialist nurse in infection prevention, and I was actually head of infection prevention through the COVID-19 pandemic for Solent NHS Trust. But what I really saw throughout my career and through the pandemic was a real lack of staff being able to even give peer-to-peer support. So I'm now in this role so that I can support all staff to be able to raise concerns so that we can create a happier and safer workforce to provide safe quality care to our patients and service users. So that's me in a nutshell.
Brilliant. Thank you very much, Bethany. I'm delighted that you're both here to have the conversation with us today. One of the things which we do as part of this campaign, and as you've just heard, Jemima and Bethany told us a bit about themselves, and I have also done so as part of a selfie. And I guess mine would be being passionate about and deeply committed to social justice, equality and fairness. I'm very, very proud of being Cornish yeah, would love to be able to speak Cornish language, but can't. I'm Chief Exec here at MHFA England. I chair the Support After Suicide Partnership, the Dying Matters campaign, and do some advising to Headspace Health. I'm a horse and dog lover. Unfortunately, my horse is called Boris, which sometimes when people, I say I'm going to ride Boris, people take the wrong images from that. And I also am married to a marvellous guy called Johnny. We'd love you to put your own selfies onto social media. One of the things which I think is really important about our whole self and the work around my whole self is that we see that we are not somebody different at home and at work. And I think LinkedIn in particular is a really exciting platform where people talk about their experiences, the good experiences, the challenges, and all different parts of themselves. So please do either using the selfie template that we have, and the information is there if you go to My Whole Self Resources, or using your own creativity and imagination. We'd love you to share them on LinkedIn, on Twitter, on Instagram, or on your other platforms of choice. And please do tag My Whole Self. Mental Health First Aid England and myself would love to see them and to find out a bit more about you all as well. So on to today's theme. We know that managers play an absolutely vital role within workplaces in building cultures that support well-being, that support inclusion, that enable people to perform well. They create the golden threads between individual objectives, team plans, business vision, and mission. And one of the things which I think is so important for us to really change in our workplaces is to make sure that all managers are trained to be good managers. So many brilliant people are promoted to management roles without the adequate training and support to do so. I know whether I would call myself brilliant and highly skilled, I know I was one of those people that was promoted into a management role without that training and support, and it took a long time to learn some of those skills which are needed to provide the support, to provide the challenge, to enable inclusive teams. And the Chartered Management Institute describes it as a phenomenon of being accidental managers, that only 1 in 5 managers are rated highly, according to research, yet 75% of people say their own manager is the chief influence on their career. So if we can get the role of managers, if we can support managers, and lots of managers, absolutely brilliant. And when they are, they're worth their weight in gold. And I'm sure there's lots of you on here who are here because you absolutely want to be the best managers that you can be. So given how much value we know managers deliver to organisations, it's important that they've got the right tools, the time, and the training to do the job of managing well. And I want to just emphasise in there about time, that sometimes we are expected to manage on the side of our desk, but taking time, having time to be able to manage people is probably one of the most important things there are, to build those relationships, to understand when people are well, when people might be unwell, when people need additional support or challenge in order to succeed. So as part of My Whole Self Day, we carried out a survey with 2,000 managers to explore some of the current challenges they face. What we found was that 75% of managers recognise it's part of their role to act on mental health, and I would argue that hopefully before long 100% of managers would be recognising that it's part of their role and it be in every single job description. But a third said that they feel as though they're out of their depth supporting their team with mental health concerns, and that's not surprising if people don't have training. And we know that lots of people don't have core training around managing, but also then don't have that specific training around diversity, inclusion, mental health and support as well. So I'm just going to start with a question for Jemima. Jemima, if you were to think about your best experiences of management, of being managed, what were they and why?
Thanks, Simon. I have so many examples when it comes to best management experiences, but when I look back on those examples, the thing that stands out for me in terms of those experiences where the managers that I had exceptional relationships with or exceptional connections with were those that actually really understood the value of leveraging equity, and those were the individuals that understood that effective management isn't just based on equality for all, isn't just based on making sure that everybody has some form of support, but they were the ones that tailored their management styles to be in such a way that it worked both ways for them as a manager and for the people that they were managing. So that if I'm to use the analogy of the shoe analogy, it's not just providing a shoe for all the people that you manage, but knowing what types of shoes that would fit, knowing what color of shoe that they might like. So for example, I love high heels. So if you're a manager and you're thinking about getting your high heels, it may miss that mark if you considered, okay, what else does Jemima do in the day that she would require? Other types of shoes, and then tailoring that to my need. And in that sense, that makes that relationship, that relationship between myself and that manager exceptional. I had a manager that I always go back to. She was my very first manager that really stood out to me. And she didn't just manage me based on the hierarchy of her being my manager and me doing what she said, but she actually took it a step further and provided certain support that I didn't have, certain guidance that I had never thought about. For example, even how to navigate my career, where to start, who to go to, how to go to those people. And that was mainly because she had had a lot of experience. She'd educated herself really well in a place where she understood how the system worked. And coming from an African background where it never had this exposure, she was like, okay, this is how it works in the UK. These are the places you need to go to. This is how you get there. And she would guide me through them. And one thing that she did and did really well is she would challenge me to step out of my comfort zone, challenge me to try something I've never tried before. So many times I'd say, I definitely can't do this. She was like, you're absolutely going to do it. And the results were amazing. I surprised myself in so many ways. And I can definitely say that a lot of the things I am today is as a result of some of the basic foundations that she gave me as a manager. And we still have that relationship, 20 years on, I still have that relationship with her. Bringing it back into my current, where I am now in Grant Thornton, it's absolutely fantastic how the firm actually makes provision for some of these sessions. So we've got our people manager development program that is catered to people managers, how to navigate and work with their people and to bring out the best out of them. We also have like regular newsletters that we share with our people managers, so it can kind of guide the conversations that they're having with their people, and support them to kind of look out for the things that their people need within their service lines, because one size doesn't fit all. So what may work in one service line may not necessarily work in another service line. So leveraging that and knowing that, okay, this is what would be great for Jemima. This is what would be helpful to Jemima. Actually, this is what will push Jemima out of her comfort zone. Those are the qualities that I think that I've found in my relationships with my people managers that really, really stood out for me and helped me to be the person that I am today.
Brilliant, thank you, Jemima. And yeah, absolutely love the shoe analogy, and also that within that, what you describe is being able to be challenged. Yeah, that when you have a relationship with somebody, they can challenge you, and you can accept the challenge and to grow from that. But I guess what's also really clear is that the descriptions that you just gave require time and thoughtfulness.
Absolutely.
And sometimes, that in the busyness of things and the rush to get things done, which I think everybody feels, and in a way COVID almost sped up, that we don't even have the time to walk between meetings sometimes and process what's happening, that thoughtfulness requires us to deliberately slow down. And I was talking to somebody recently who just said, I just do a minute of breathing before every one-to-one that I go into, just to remind myself that what I've just done isn't important for the next hour, and what I'm just about to do after the hour isn't important. I've just got to get myself into that now. So thank you. That's really, really great insight. And I'm just looking through the chat briefly and seeing that you're also giving your own tips and advice. So please do keep sharing in there as well. This is great to have so much experience on there, and some fellow Cornish people, some fellow glampers, etc. Okay, so if we then just look at a few more of the survey results before coming to Bethany, the 2023 results. Over a quarter of managers said that if they had more support and training from their employer, it would help them to create a team where everyone feels they can bring their whole selves to work. That 74% of managers are concerned about their team's mental health due to the cost of living crisis. And really, really importantly, that 26% of managers have had a loss of confidence in the past 6 months. And this was one which I was really interested in, and I sort of did that what researchers would probably call non-research, in just talking to some people in my network about what some of that loss of confidence might be. And I think just that bit of reminding ourselves that there are so many things in the world that we can't control, that as managers we need to be focusing on the things that we can control, and also making sure that we're getting the support ourselves, and that if if all of us just take 10 seconds and think, how many things have we learned over the last 3 or 4 years that we just didn't know? Words like furlough, what does it mean to furlough? I remember the announcing that, didn't know what it meant, had to look it up. Managers have had to deal with all sorts of things. We have had to deal with all sorts of things. So it's no wonder in that context that there might be a loss of confidence. So how do we step back from that and go, actually, how do we use that experience and all of those challenges and all of those learning moments to take confidence from it rather than to lose our confidence instead? And would encourage all of us to really think about, how can we use all of these learning experiences to build our confidence rather than to let it knock our confidence, which of course is what can often happen if we feel tired, if we're unwell, if there's circumstances outside of our control. So Bethany, you talked about your varied career, two quite different roles in terms of military and then in the NHS, both very focused around public service. But what have you learned about the training support that managers need to do a good job, and what are the barriers or helpful things that you've experienced in that process?
Thanks, Simon. Yeah, so my experiences and what I've learned about supporting managers is everything that I've drawn on from both my military and my current NHS career. I think reflecting back on my military career, when I got to that sort of management stage, the military is very hierarchical and process driven, and rightly so, because we have to respond in times of conflict and different situations. So when I became a manager in the military, there was lots of different training, lots of different courses that equipped me to manage people in lots of different situations. But actually, I'm not sure it focused on the person as an individual. So it was very much, the needs of the military come first. We do the job we have to do as soldiers, as officers, and actually the needs of the person come after that. It has changed, obviously, a lot, because, our workforce, whether they're military or civilian, are humans, and all humans are individuals and have needs. And there was times when I had to draw on my compassionate leadership as a nurse in the military. So, for example, when we were going to Sierra Leone for the Ebola epidemic, it was about really listening to those junior staff who really had real fears about their safety, about the safety of each other. So it was actually, what elements of my management experience and experience of me being managed could I draw upon to support them? Coming into the NHS in 2016, I worked my way up to sort of like management level and became a head of the infection prevention team about 6 months before the pandemic. It was an interim position. I didn't get any specific courses on managing. I kind of learnt on the role. So drawing from peers, other managers, asking for advice, asking my line manager how to support staff where I needed to go, and then hit the pandemic sort of like ground running, and had to really work out how to support my team as a manager, because we were in a high stress situation in the pandemic. So drawing on all my experiences and what I knew, it was really about remembering that, again, like I've said, our workforce is made up of humans, individuals, and what our managers need is the skills to be able to treat each of our workforce as individuals. And for me, it's about bringing it back to basics. So managers need to remember, so you spoke about psychological safety earlier, Simon, and I think sometimes our managers don't really understand what that means fully. So how do we explain that to them? How do we make them aware of what psychological safety is and the impact it has on our workforce? So for me, I think managers need training. So back to basics. So in healthcare, we always talk about our patients and what are their needs, their hierarchy of needs. Well, actually, let's bring that back to our workforce. What are our workforce's hierarchy of well-being needs? Are they getting breaks? Have they got hot water, toilet facilities? Are we listening to them? But actually, are we hearing what they're saying to us? If we're listening and hearing, they're going to start feeling valued. And the more needs we can meet, the more valued and heard our workforce are going to feel, and therefore they're going to perform better and provide a better output, whether it's in healthcare, business, whatever area. So I think for me, the things that managers need are those back to basic tools to be able to support our workforce as individuals, to make them feel safe at work. But there are many barriers. So cost of living is being mentioned, that's causing stress, but not just on our workforce, on our managers as well. Waiting lists in the NHS, getting out of the pandemic, post-COVID, there's so many barriers, resources, time is a huge one. To be able to manage our people, we need time to do it properly. And I think that is one of the biggest barriers to managing a workforce at the moment.
Brilliant, thank you, Bethany. I think that if you look through the chat, I think you would see everybody supporting that idea of managers also needing the support. And I think it's interesting, isn't it? As both you and Jemima have been talking, it's that bit of taking the time, people giving the time, people having the time, and so perhaps one of the key bits from this is really that sense of time is one of the most valuable resources that we have, and it doesn't always have to be incredibly complicated in terms of what people need. It's actually that time to listen, be heard, see where they could be supported, challenged. And somebody in the chat talked about coaching, that management should be coaching rather than command or control. And there's a brilliant book which is the 7 questions for coaching habits or something. I'll find it when we get to some of the next questions and put it in the chat, which I think is a really useful book for people to read. Just thinking about that, the better we are with asking questions, the better our management. Jemima.
I just saw a lot of comments about time, and I just remembered something that my current manager said, that time is something that is really precious, and we as much however much time we get, we know it's never enough. So finding smart ways of making time work for you. So one of the things that she does is that every time we have a team meeting, if that call is an hour, she'll put 10 minutes at the beginning and 10 minutes at the end to check in with the team. So the first 10 minutes is how are you getting on in your personal life, outside of work, what's going on with you. And then at the end, do another check-in to see how they are. And I found that really, really beneficial. So we still have the hour of that meeting. The content is covered within the 50 minutes, but the 2 ends, kind of takes that time into consideration of me in that meeting as well. And I think it's absolutely been life-saving for me in some instances.
And really, really helpful to know. And we're going to talk a bit more about the Manager's Toolkit in a moment. And one of the things that we do at Mental Health First Aid England, the first question that managers are expected to ask is, how are you and what are you doing to look after yourself? And the reason that we ask that as the same question is not so much that the answer is as important as any changes in the answer. So if I am asked that question by my chair each time, and they hear me normally saying, well, I do X, Y, and Z, and da 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 da, and then suddenly I say, oh, I haven't really done anything. It's about what's the change, and then being able to say, oh, usually you say this, but this time, is there anything that we need to worry about or think about? So it gives you that sort of barometer. The coaching habit, say less, ask more, and change the way you lead forever is the name of the book. I will make sure that we type it in a moment, but the coaching habit, say less, ask more, change the way you lead forever. It's not too thick. It's one that you can read in a short amount of time as well. Brilliant, thank you. So today we're launching our My Health Self Managers Toolkit, and that's really to try to help managers throughout the whole employee life cycle, giving ideas and tools to support them in their role. It's got practical advice for managers and asks a series of practical questions to help people to think. I think it was Jemima who said there's no one size fits all, and I think we would all agree with that. So these are questions to help us think through different bits, and you can download that from the My Whole Self resources page. Just wanted to really emphasize that, talking about mental health, creating inclusive cultures, enabling people to take their whole selves to work is really part of that management suite. This isn't something that's separate or different. And we work closely with the Chartered Management Institute and really recommend that you look at the resources. There's the professional standards wheel, which is on the screen here, which has got ethical and inclusive leadership at its heart. And I think that really is about building the foundations from which we train in mental health skills as managers, train mental health first aid, really having those foundations to be able to build on and recognize that this isn't something separate or different or unusual that we should be expecting, but is absolutely core to managers. Also, just to direct you to some of the other resources which are available. And I saw somebody in the chat said, I've got 100 people, I think it was, that either I manage or I run the team with, and how do I get them to do check-ins? And somebody gave that really good idea of get people to ask questions of each other, creating the space and time, give people permission. So for the My Whole Self MOT, it might be something at the beginning of team meetings that you get people to ask each other a few things. And there's also some tips around good conversations as well. Also seeing some things around sanity strolls. So loving the idea, walking meetings, getting out and about. And I do think that as managers, that sort of sense of walking, talking, can be really helpful, particularly where we might well not be leaving our kitchen or our bedroom desk. Can we get out and walk and talk at the same time? Can be really, really helpful. So managers training. Let's keep focused around back to managers. The case for investing. The data from the Workforce Institute shows that for almost 70% of people, their manager has more impact on their mental health than a therapist or a doctor, and it's equal to their partner. That work has a really, really significant role to play, either in positively boosting health or negative, and managers play an absolutely critical role about that. We know that poor mental health is estimated to cost UK employers up to £56 billion each year. And I just want to put that in context that only 3 years ago, that was 45 billion. And only 3 years before that, it was 36 billion. This is modelling done by Deloitte, so really robust modelling. And the same report suggests that for every pound that's invested, you get fivefold return. So I think it's really, really clear that investing in enabling managers to be able to do the job well is incredibly important. So training, making sure people have got knowledge, awareness, understanding, helping people to understand their roles and responsibilities. MHFA England obviously provides training through mental health skills for managers. We've also got knowledge for managers and also mental health first aid, which is something which is training which is suitable for managers as well. But I think the really important bit about this is about us really enabling managers to feel motivated, to feel committed, and to understand that we can do this, that this is something that is really really just a core part of everyday bits. And when we're talking about performance, we're talking about well-being. When we're talking about well-being, we're talking about performance. They're absolutely connected. So just before I go to the last question, which I've got for Bethany and Jemima, I'm hoping that you'll have some questions for us as well. So if you haven't already, please do go into the Q&A, get your best questions for us. And if you have already put a question in the chat, can I ask you to transfer it over to the question and answer, because the chat's moving too fast for any of us to keep up with. So Bethany first, and then Jemima. If you had a minute or so to give your top 3 tips for managers to help them make sure that everyone feels seen, heard and valued, what would they be?
So I think my first one, Simon, and it comes back to time, is making time to listen. So I think sometimes we think we listen better than we do. So, you know, if somebody says they want to speak to you about whatever it is, if you're busy, just let them know, but make a specific time to talk to them. But when you're in that time, switch off your computer screens, mute your team so notifications aren't pinging through. Make sure there's absolutely no distractions, because I think we're all guilty at times of sitting with things on in the background. So are we really listening? So really make time to listen, and more importantly, to hear what people are saying. I think daily check-ins for managers, that's come up, but I did it through the pandemic with my team every day. It was a daily check-in. How is everyone? Anything anybody wants to sort of like speak about, raise concerns, etc. And also give feedback to your teams. So often people will say things, they might ask questions, raise things, but I think we can be very poor at actually feeding back any actions that we've taken, but actually knowing that they've been listened to, knowing that there's been follow-up and feedback. I think that really does help to make people feel valued. So they would be my, and say thank you as well. Always thank people for talking to you. So yeah, that would be my tips.
Brilliant, thanks Bethany. So listen, hear, don't be distracted when you're listening and hearing. And I think that bit feedback mechanism is the really important bit, isn't it? And I thought you were going to say something slightly different. So I just want to just pick up on the feedback. One of the things which I think is really critical for a manager and is great for our wellbeing is when we know that we're doing a really good job and we say thank you, but also when we know that actually there's room for improvement and there's room for change, that is equally as important. And I always remember a colleague saying, this may not feel like a gift right now, but it is a gift and it will help you be better in the end. So finding out how do we help people to be able to hear feedback, which enables them to grow and develop as well.
Yeah, no, I totally agree, Simon. And I was trying to narrow it down to my 3. I could have gone quite a lot, but yeah, absolutely. I think, you know, feedback, whether it's positive or negative, for me, in my role at the moment, when somebody speaks up, it's about how do we feedback. So it doesn't matter if it's a concern that's being raised, actually, we're learning from this. We're identifying what changes we can make to make improvements and then feeding that back. So it's all about linking in those conversations into a quality improvement cycle. All the conversations we have are a gift, whether it's positive, negative, we can learn from all of those and really drive improvements forward in our organisations.
Brilliant, thanks very much. Thank you, Bethany. Jemima, what would be your top 3 tips for managers?
Oh, that was so good, Bethany. Thanks for sharing those. But I'd say my number 1 will be self-care. You know, you can only give as good as you are, in the sense that how you're feeling. If you're feeling absolutely, you know, horrible, you're going to give those horrible, you know, emotions or those expressions without even realizing that you're giving the negativity you're feeling. So take time out for yourself, look after your own mental health so you can give of your best to others. My second one would be understand and recognize difference in order to be able to adapt and be malleable. I'll say the best animal I can use to describe would be a chameleon. If you understand difference, you know how to adapt to the different environments that you're placed in with the people that you're managing, and you'll be at your best because you're able to recognize, understand, change, and then mold to what you need to be at your best as a manager. And my last one would be my 3 C's. And the 3 C's are choose to take chances to see a change. So if you make those choices on people, you take those chances with people, you'll see a change in them. So you can have the worst person to manage, or you can be the worst in yourself, not feeling great. But if you choose to take a chance, you'll see that change come into fruition.
Great, thank you, Jemima. The three C's, believe in people, I guess, isn't it? Is really that bit. And I just to bring your bit about, you know, taking individuals to heart. I learned that, you know, if you've got difficult feedback or feedback that you should always tell it face to face, that it shouldn't be written. And I remember in one of my first jobs, someone said, you know what, it'd be much easier if you emailed me this and then said, we're going to have a conversation. And it was in that moment that I learned that actually we don't all like things done in the same way, that sometimes just saying, if we're going to celebrate something, what would celebration look like to you? If we need to have a difficult conversation, what would it look like to you? And asking people in order to help to understand that. So brilliant. Thank you for those top tips. And if you've got top tips that you want to share in the chat, please do keep sharing them. So we've now got some time for questions. So let's just go into the Q&A. First one's from Rachel. How can we empower our own line managers, let them know what is important to us in their line management of us, i.e. when support has been poor previously, but we don't want to approach it from a critical place? So I think Rachel's talking about managing up here. How do we give that feedback? How do we let people know about the way that we might like to be managed? Jemima, Bethany, any thoughts?
I'd say be true to yourself as an individual, because your core values will always determine how you react. Whether the manager is giving you what you need or not, if you're true to yourself, then you'll be honest with that person and bring them in. I think some of the times we kind of feel like it's a hierarchical process and that's my manager, I can't go to them about this or I can't go to them about that. But if you recognize that you're managing each other, you're in a two-way relationship. It's not just the fact that my boss says this, I do that, or my manager says that, I do that. And it's a two-way process that makes it so much easier. So if you're feeling absolutely low, be confident to say, do you know what, I'm really sorry, I'm not having a great day. Can I have some time out? And if you've built that relationship with that person, they will know how to support you. They'll know what you need and be able to give you what you need in that circumstance.
Great, thanks, Jemima. Bethany, anything you'd like to add to that?
No, I completely agree with everything Jemima says. It can be difficult though sometimes to approach a line manager to empower them or give them feedback, because actually if our manager hasn't got the right skills and everything, they can be very defensive in that, and it can sometimes break down relationships. But if you do feel confident to speak to them, just be very honest and open with them about how you're feeling, about how you feel they can help you more, and try and make sure that you say it in a way that doesn't come across as very critical towards them. So turn it round. Actually, I really think I would work better if you could do this, this and this to help me work better and things like that. But it's just about having those open and honest conversations, which will hopefully be two-way and become really normal as we move forward. But it can be difficult. Those conversations aren't easy, and it's okay for them not to be easy.
And I think the key bit in that, of course, is that this is about a relationship, isn't it?
That's right.
As what both of you are saying, and relationships work best with good conversation and good communication, and so really important. Okay, so Namal, with the changing mental health awareness, should employers now consider that job adverts, job description should include mental health training, supporting employees, that a manager's role is now beyond meeting their own KPIs and that of their employees, that part of their role is caring and supporting of their colleagues and teams? I'll kick this one off and say, in a word, yes. I think that it is absolutely, and behaviours are often, of course, less often measured, but actually, a manager's KPI is about creating the teams, because their role is enabling others to do the work as well. So I'll kick it off with a yes, but in true, I guess, panel show, I was going to say, the Bethany, Jemima, anything that you want to add?
I mean, for me, it's a yes as well. Like I've alluded to earlier, our workforce are the main drivers to a successful business outcome, delivery, whatever it is. So absolutely, I think managers have that role in supporting employees' mental health, well-being, etc. So I know, in the health service, it's often in the generic sort of role description linked in with our values and everything, so it's expected. But I think that there is wider than the health service. Obviously, I think it should be in all managers' kind of like expectations that is part of their role, and then how we manage that with training in different circumstances, you know, would have to be something that's addressed. But absolutely, I think it should be an expectation in the job description, discussed at interview, etc. Because not everybody coming to a management position will have that on their the forefront of their mind. They might be going in very much focused on, you know, I want to be a manager because of this and this, and driven by the outcomes of the business, etc., and forgetting it can be you can get very blinkered sometimes on what you want to achieve. So it's just about having those conversations again and making sure that they're aware that actually it's really important as a manager that you look after your workforce, because that's how you're going to get the most productivity out of them.
Absolutely.
Thanks, Bethany. Jemima, anything that you want to say?
Absolutely, I agree with what both of you said, and I think it's essential that as individuals, as managers, as people in this space, we recognize that it's not, we shouldn't have a tunnel vision. We should look outside. We should look beyond this is what our remit is and this is where we're staying. No. Beyond that remit are people, are individuals with their own personalities, with their own things that they're coming with. And now the job market is so hot that people are looking for what can you do for me? I'm bringing my expertise. What can I get from your company? What can I get from your organization? And that's what sets any organization apart for someone that's looking for work. So if you haven't got those systems in place, you're not going to get the best out of the job market. You're not going to get the strong candidates coming into your organization. So it's not just good for business, you know, it's beyond just great for business. And once we invest in our people and training them to have, you know, really good conversations when it comes to mental health, and knowing who to go to for mental health support, knowing what services that their company provides for them as individuals, for that makes all the difference. And I can't shout about my firm enough. Like, I've worked in a lot of companies, but for me, Grant Thornton stands out. For me, Grant Thornton has given me that space for me to be able to know that if I'm having a legal problem, I can contact this place and they'll support me through my company. If I'm having a health challenge, I can go through my company again, and it makes life so much easier. And you give more than you would normally give, because you can see that your organization is supporting you and bringing the best out of you. So your productivity, nobody even has to question your productivity in that sense.
Great, thanks, Jemima. And then there's a question, Sarah. We're just in the process of doing some work around making the mental health skills for managers course available for IMs, and so further information will come out in the newsletter and other things in relation to that. Julie, I line manage someone I know has issues outside of work and talks to other colleagues about it in confidence, but does not seem to want to talk to me. Do you have any advice on supporting someone who doesn't want to be supported?
Yeah, I mean, for myself, I think it's, you know, just make sure that even though that they don't want to be supported, don't stop offering that support. Make sure that they know that there is support available should they at some point choose to. But maybe also think about, is there a reason why they don't want support from you? So are you making time for them? Are you providing the right sort of like environment for them? But actually, if they've got colleagues and they're happy to have support from them and that's helping them, then that's okay as well. But then actually, do the colleagues need some support if they're being offloaded to a lot? So I would say if that person really doesn't want to come to you for whatever reason, just make sure they still know there is support available should they ever change their mind. But also think about, do the colleagues that they are going to, do they need any support? Because they might be getting burdened. But it can be difficult. It can be very frustrating as a manager when that happens. I've been in that situation. So yeah, for me, it's just about just keep reminding them, make sure they are aware that if they change their mind, and that support is there for them. And other avenues. So for example, where I work, if they don't want to speak to me, they might feel happy speaking to the trust chaplain or linking in with one of the staff networks. So actually, what other support is available within the workplace outside of you and the colleagues? Yeah, Jemima?
I'd say exactly the same, Bethany, but with regards to the why, I think sometimes we box ourselves in thinking that providing support for somebody is just me telling you what to do or where to go to. But support means even liaising with other colleagues. So if you know who they're speaking to, you can go to them and say, I recognize that so-and-so is speaking to you about this. I feel there's a great resource on the employee such and such. Can you signpost them to that? And I think that sets you apart from someone who is constantly going, oh, why is she not asking me? Why are they not asking you? You know, to providing that exceptional support that they don't even recognize that you have done in the background. And that's having that oversight of, you know, what are the strengths of the people that you're working with, or what are the areas that the people that you're supporting need the support in. And if you know that this is what their challenge is, absolutely make a provision for them to have access to it, even if it's not directly you that they've come to. And I would say it's also about relationship building as well, as I said earlier on. Sometimes we don't have any relationships with the people that we manage at all, and then all of a sudden there's a big bombshell. It'll be very difficult if you don't have that relationship to communicate that to that person. So start from somewhere. If it's just inviting them for coffee, do that. Start from somewhere.
Great, thank you. I've just looked through the list of questions, and I've also just looked at the time. So I'm going to ask us now. We're going to move a bit more swiftly through some of these. So the no discrete place for employees to talk to our mental health first aiders. Walking and talking is not always an option. What would you suggest, Rebecca? I guess the key bit would be really thinking creatively. Where is there your opportunity? Is it online? Is it over the phone? Is there a place, a time, a moment? Without knowing circumstances, I think it's difficult to say, but I think the key bit is recognizing the need for there to be discrete places or spaces online or in person that do need to be found, because people will only feel able to speak if they have issues they don't want overheard, where there is discretion. So I'm happy for you to get in contact with us if you want to try to get more information. But I think it's that bit of working with what we've got. Most of the time, remember, we don't have perfection, and so we have to work with what there is available. Okay, the next one, I'm looking for HR support in enabling line manager training to equip them with certain conversations. I'm struggling to get momentum and buy-in here. Apart from being the right thing to do, how else do you recommend I tackle this? Catherine, the slide £5.30 for every pound spent might be your most effective one. I guess that would be my bit. You know, if people are not bought into it being done on a moral basis, people often are on an economic basis, but also articulating what the issue is, really trying to be clear. That sometimes I think we can think it's obvious, but if we can articulate it with examples, that can be helpful. Bethany, Jemima, anything to add to that?
I think you've got it spot on, Simon.
Okay, we're a small team who work remotely. We don't have an office since lockdown. I work part-time, find it hard to support the team. My manager is wearing too many hats. What initiatives can I bring in to support mental health and well-being? Bethany, Jemima, one idea each.
Get allies, get more people involved. You can't do it all by yourself. So if it's a mental health first aider, if it's health champions, it's inclusion allies, whatever allies you can get some champions in the process with you, and they'll support you.
And just quickly, I would say have an open and honest conversation with your manager so that they can support you better as well.
Great, and then think about the days would be my idea that exists. My whole self is Mental Health Awareness Week coming up. It's Stress Awareness Month in May. We've got World Mental Health Day in October. That often people think, oh, it can feel tokenistic. It can often be a starting point. It might be a moment that you can say, does anybody want to help me to do something for World Mental Health or Mental Health Awareness Week, etc. Gareth, I think we might need a few more than a couple of minutes here. Tips on how to improve psychological safety when it's not strong in the culture. There's quite a lot of work and reading around psychological safety. I guess what's the best thing to do here, because I don't think we can give you a satisfactory answer. If you want to email me at ceo@mhfaengland.org, I can send you some links and then perhaps have the conversation. So perhaps if a colleague could type in the CEO email address, and then we can hopefully, Gareth, point you in some direction there. Lucy. Someone in my team, mental health conditions, keen to support others and supporting our wellbeing champion roles, sometimes triggered heavily themselves, it impacts their day. The really important bit about this, Lucy, and Jemima and Bethany, I'm sure will say exactly the same. I think they've said it, is people have to care for themselves. And that's the really, really key and important bit. And that, yeah, that whole bit around self-care, and you can't pour from an empty cup. So I would suggest an open conversation with them about the impact on them as a starting point. Bethany, Jemima, anything to add?
Yeah, I think you're spot on, Simon. If there's anything else I would add would be take that extra step. Just take that extra step to give that opportunity for people to do that.
Great, thank you. How would you suggest having conversation about mental health when you're not feeling so hot yourself? How honest should you be as a manager? Jemima, Bethany.
So yeah, this can be tricky. I guess it depends on how comfortable you are with that person and how much you want to share. But you know, I think vulnerability can be a strength, so you don't have to give all the details. But also it might be that you're honest and say that you don't feel that you have that capacity to support them at the moment, but there is X, Y, and Z routes available. So I think it comes down to that relationship again. What is that relationship with that person? How open can you be with that person about how you're feeling? But making sure they're not left with any support. How can you signpost them for help elsewhere, potentially? Yeah,
I'll say in short, tactical honesty. Tactical honesty. If that means just putting an emoji on your status, do that. If you're a happy person and you've got a sad emoji, they know that you need that time out. So tactical honesty.
Great. So I'm just going to start trying to sum up, rather than asking the specific questions. There were a few themes in the chat which were about care for others. I think there's a point here, which is that people will find somebody they trust, and sometimes that will be the manager, and sometimes it might be somebody else, and sometimes it might be somebody else outside the organisation, and it might be the EAP. And the really important thing is that people know there are options. We can't solve things for everybody, and it's not our job to solve things for everybody, but making sure people know that there is an openness, making sure people know who can provide the support, and making sure that people know that there are a range of different places to get support, I think is really, really critical. The second bit, which is around managers and around allies and around getting help. You know, Jemima said it perfectly. No one person can do this alone. There will always be more than one person that's interested within the organisation. So find those people, you know, invite people for a cup of tea and say, who wants to talk about well-being in the organisation? Let's have a cup of tea together. Let's start. And yeah, I don't know what I was going to say. Lots. No, you can't eat an elephant in one bite, but that's not a very good thing to say, is it? So I can't say can't. There's lots of ways to skin a cat either. Well, just taking little tiny steps is the important bit. Don't think that we've got to get from 0 to 100% in one go. And then finally, people talking about the case for investment, about influencing people. I think there's a moral case here, which is about supporting people and the human cost. There's the economic case. We know that it benefits organisations bottom line if they support people, and we know that there's that wider sort of social responsibility for businesses to contribute, you know, through corporate social responsibility. But that key bit about finding and describing the issues in ways which people understand and trying to think about what will influence, and remember that sometimes you can't do it in one go, that influence takes having several goes, or asking somebody else to talk, or saying, actually, can we think about this in slightly different ways? So much that we could talk about, and it's 11:30, so I am going to draw us to a close. I'm going to say thank you very much to Jemima and Bethany for sharing so openly. Thank you to the 1,000+ of you who've joined us today. Please do download the resources. Please do share your self-deeds on LinkedIn, on Twitter, on Instagram, on other places. And if I can just say enormous thank you to all of you for all you do day in, day out, for taking the time out of your day to come and have this conversation with us. I hope you'll continue it in your organisations. And thank you very much, Jemima and Bethany.
Thank you too, Simon. Lovely to meet you both, Bethany and Simon.
Thank you.
Thank you, everybody.
Thanks, everyone.
Bye.